welcome to our session on innovations in home health, lessons from COVID-19 and impact on future kidney care. I'm Jennifer Jones, a retired Marine veteran, member of both the AAKP National Board of Directors and Executive Committee and an AAKP National Ambassador. My kidney journey began while deployed to Afghanistan in 2011, and what felt like a blink of an eye, I went from serving as a combat camera videographer to being medically retired in 2013 due to being diagnosed with a rare autoimmune disease called membranoproliferative glomerulonephritis type 1 idiopathic. After starting dialysis, I felt out of control of my life and my situation. I knew I would have to make a conscious decision to take back control of what I could and be my own best advocate. I went on to share my story and found a living organ donor in 2015. Due to rejection, I recently returned to dialysis, but not without hope, faith, and a plan. When I returned to dialysis, I knew immediately I wanted to pursue a home dialysis therapy. I felt home dialysis would give me more control over my life, my schedule, and my health, so I pursued peritoneal dialysis. Additionally, as the coronavirus pandemic continued, with kidney patients being noted by the Centers for Disease Control and Prevention as a group that is at severe risk of complications if they contract the virus, I knew a home therapy was the right choice for me to help me stay home and stay safe. I'm pleased to share that I'm currently on track to receive a kidney from another living donor. I became involved with AAKP because I wanted to join a group of like-minded individuals who were passionate about improving the quality of life for all kidney patients and their caregivers. Who better to understand the needs of the kidney patients than the kidney patients themselves? Being a part of AAKP has allowed me to be a member of the AAKP PERCORI-funded Peer Mentor Project Stakeholder Committee, the Stakeholder 5 Committee with the Scientific Registry of Transplant Recipients, the Black Women's Health Imperative Rare Disease Diversity Coalition, multiple Capitol Hill Advocacy Days, and much more. I would now like to move forward with our session and am pleased to introduce our panel of speakers, which includes Dr. Mary Gellens, Senior Medical Director of Worldwide Medical Baxter Healthcare. I would now like to welcome Dr. Gellens.
Hello, thank you very much for allowing me to be able to speak to you all today about home care and dialysis and innovations in COVID-19. My name is Mary Gellens. I'm a nephrologist and work for Baxter Healthcare in the Medical Affairs Department. What I'm going to speak to you today about is innovations in home health and lessons that have been learned from COVID-19 and how that impacts the kidney community now and in the future. COVID has really impacted the dialysis community quite a bit. What you're looking at here is data from the USRDS, United States Renal Data Systems, which is the really most robust registry in the country, if not the world. And what they've done is they've been looking at the incidence of COVID in the dialysis population. So if you look at the graph over on the left on the bottom, what you can see is two peaks over the last year in 2020. And these correspond to the percentage of chronic dialysis patients that contracted COVID in the April to May timeframe of 2020. There's the first peak on the left, and then the peak on the right is in the November timeframe. So a lot of dialysis patients did contract COVID over last year. If you look at the graph on the right, then it's been split into hemodialysis patients that contracted COVID as well as peritoneal dialysis patients. The upper line is the hemodialysis patients that got COVID, and the lower line is the peritoneal dialysis patients that got COVID. So there's obviously a lot more hemodialysis patients than there are peritoneal dialysis patients, but these are percentages. So the impact on the in-center community has been more than on the home community. However, a lot of things have been done in center and at home to help prevent the spread of COVID in the dialysis population. In center, patients have social distancing now. There's a lot closer monitoring of symptoms of patients or caregivers. Personal protective equipment has increased in its amount and sophistication. So a lot of things have been done in center. What I'm going to talk about today is what's been done in the home situation to help prevent the spread of COVID in the dialysis population. One of the things that was done by CMS, the Center for Medicare and Medicaid, is change reimbursement such that now telehealth has been covered from a financial standpoint, not just in the dialysis community, obviously, as you've all seen with all your healthcare interactions. Telehealth has exploded in the last year and a half as far as helping people still interact with their healthcare providers, but without having to come into the clinic. And this has really impacted the dialysis community quite a bit. What I'm showing you here is a schematic that shows how telehealth has affected the dialysis community, particularly patients on home dialysis. This is a schematic from an American Society of Nephrology, ASN, paper that goes through how telehealth works really in the dialysis community. So if you look over on the left there, as far as what stakeholders are involved with telehealth, obviously the patients are involved. Now they can see their healthcare providers without having to come into the clinic. Not only the patients, but also their care partners and families can be involved in a telehealth visit, which is a big plus. The staff can be involved, and it affects clinicians, payers, regulators, and everybody, this telehealth process. Now, the advantages of the telehealth process now are seen at the bottom of this slide. Now patients can have good oversight from their healthcare provider without having to come into the clinic. In addition to using the telehealth platform, also you can use remote patient management, and I'll talk about that a little bit more. As mentioned, now family members and healthcare partners can be part of the visit, which is great. Obviously, there's less interaction with the clinic and other patients, so the chance of exposure and development of COVID has been decreased. And with these telehealth visits, you can see your whole healthcare team. You don't just see the nurse and the physician, you can also see your social worker, dietitian, pharmacist, and everyone else. There are some concerns, though, with telehealth. Nothing is perfect. And if you go to the top of this slide here, there are some security issues. There's internet connectivity issues. Patients have to have computers and whatnot, devices to interact with their healthcare team, and there can be privacy issues. And then over there on the right then, as far as future needs and considerations are concerned, these platforms need to be improved. We need to see if it works. A lot of healthcare providers and patients much prefer a person-to-person visit. So we need data on whether these telehealth type visits and using remote patient monitoring really helps from an outcomes perspective and can improve things. And I have some data on that. So how does remote patient management work with telehealth and this whole kind of digital explosion that's happened in the last year and a half or so? So just to set everybody on the same stage, I'm talking about peritoneal dialysis right now and home peritoneal dialysis with patients on cycler therapy. So if you look on the left of the slide, this is a typical patient who's at home using the cycler for their peritoneal dialysis. So the way it's called APD, automated peritoneal dialysis, the way it works at home is that fluid is in the peritoneal cavity during the day when you're walking around and doing whatever activities you have, and then you hook up to the device in the evening, and the device has make sure that the fluid goes in and out the peritoneal cavity until you have these cycles and you get your peritoneal dialysis over the evening. Now, if you look at the right of the slide on the top, the way this whole automated peritoneal dialysis worked as far as interacting with your healthcare team, that's shown in the top little cartoon there. So the patient on the left has their peritoneal dialysis, and then if they have to interact with, over on the right, the nurse or the physician, they go into the clinic and personally see the nurse or the doctor. Now with remote patient management that you see on the bottom, the patient has their treatment, and then all the information from their device goes into a cloud where on the right of the lower section there, the nurse or the physician can see all this information that comes from your cycler device and assess it and decide if anything needs to be done, and then can call and recommend changes. The other thing that can be done is actually prescription changes for your device can be pushed out through the cloud so you don't have to come into the clinic and have a prescription change done. So remote patient management is really great as far as limiting patients' exposure to the clinic and other patients. So what has the experience been with remote patient management and telehealth over the last year and a half or so? So what I'm showing you here are 3 articles that were published in the last 18 months or so that looked at home patients and use of telehealth and remote patient monitoring. So the study on the left there by Uribarri and his group is from Mount Sinai. And all they do is describe really their experience using telehealth and remote patient management. So they had 80 patients at Mount Sinai that they had on telehealth and remote patient management. And the kind of platforms they used for the telehealth piece included WhatsApp and Zoom and FaceTime, anything really that worked. And what they also used ShareSource as far as their remote patient management tool. And then during telehealth visits, they visually inspected the exit site, and then the discussions between the physician and the patient going over all the data is the way they handled their visits. The middle paper there is from the Rogosin Institute in New York, where they describe their experience with peritoneal dialysis patients and telehealth. They had about 150 patients, and they used Zoom all the time for the video part. They also used remote patient management. And in that situation in Rogosin, the patients didn't come in unless they needed to be trained. So they came in person for training. They came in person if they were urgent start patient, or they came in person if they developed peritonitis. The last paper there on the right is from Dr. Bunch and his team in Colombia, South America. This is a report from about 1,000 patients. They used telehealth and remote patient management, and they increased their protocol a little bit. They also called the patients weekly and monitored the remote patient management data that went into the cloud on a daily basis. And some of the clinical outcomes that they saw were reduced, actually no change in the peritonitis rate of the patients, and actually a reduction in blood pressure of some of the patients. So some other data that has been available on remote patient management before the COVID epidemic is listed here. So one is improved patient management. So what does that mean? So there was a study actually from United Kingdom where about 25 nurses used remote patient management system for about a year. And the nurses were completed a survey as far as how they interacted with patients and did patient care before and after they started using remote patient management. And one of the things that happened with that, with using remote patient management, is they sort of changed the way they interacted with patients. Before, they used to be much more reactive. So when problems arose, then they would deal with them. Whereas with remote patient management, and you can see a lot of the data ahead of time, you can be more proactive and try and eliminate some of the problems before they happen. And what happened in that group, the proactive part of nurses' care went from about 2% of their time, so they were hardly doing anything proactive before using remote patient management, to about 34% of their time was spent in proactive activities once they were using remote patient management. There's some more data also about reduced hospitalizations. This is also from that Colombia, South America clinic. They looked at 1,000 patients and found a decrease in hospitalizations. So the hospitalization rate without remote patient monitoring was about 0.9 episodes per patient year, and with remote patient monitoring went down to about 0.5. So almost half, almost a 50% decrease in hospitalization rate. Hospital days also went down. Used to be about 12 days per year that patients were hospitalized before remote patient monitoring, and that went down to about 5 days. So there are definitely some improved clinical outcomes using remote patient monitoring. And other data has shown a decreased patient dropout using remote patient management. There is data that showed a 55% decrease in drop-off rate using remote patient management with cycler patients. There's also been data that shows improved fluid management, and also data that's showing decreased training time using remote patient management with patients. In sum then, the question is, how has COVID impacted the dialysis population. I think I've gone over that quite a bit here. And then what has innovation done to lessen the risk to the dialysis population? Implementing digital technology has been huge and has really helped in many ways. It's allowed patients to stay home and social distance and decrease their exposure quite a bit. And there's a lot more innovation, digital innovation on the way that can improve patient care, not only around COVID, but in the future for overall patient care, I would say. Thank you very much for your time. It's been a real pleasure to present. Thank you.
Thank you, Dr. Gellens. If you would like to learn more about home dialysis options, please visit the AAKP website at www.aakp.org and click on the Education and Resources box at the bottom of the home page, or check out additional information under the Center for Patient Research and Education tab by selecting dialysis. You can also find the latest COVID-19 information impacting kidney patients by clicking on the red Coronavirus Information button at the top of the AAKP website. Again, we thank all of today's speakers and thank you again for joining us.